So we're going to present the second report of the Brave New Connections project, which is a collaborative initiative led by Mental Health Reform and funded by the RTE Comic Relief Grant. We started the project last year in response to the pandemic. At the beginning, we wanted to learn more about how organizations in the sector responded to the pandemic, what challenges they faced, and how they adapted their services. This piece led us to start a program of activities and supports. We've organized many knowledge sharing events and bilateral collaborations that we're hoping to continue even past the official end of the project in June. Now this second report has a bit more strategic value. It also has been developed by the innovation team, namely by Kevin Cullen, who is our scientific advisor. But Kevin is also the director of Warwick Research Centre that collaborated with Mental Health Reform over years on a number of projects. I would like to also mention my colleague Dominique Phillips at the reception desk at the moment, who contributed largely to the project. She's coordinating the Brave New Connections project. If you have any questions, you can email Dominique directly. So I would like to invite Kevin now to tell us more about the report. By the way, this is just the executive summary, and the full report will be available online from tomorrow.
Thank you, Dominica, and good morning, everybody. It's a pleasure, I suppose, and a privilege to have the opportunity to tell you a little bit about the report which is being launched today. It's not my report. I mean, the team produced it, but it was based on, very extensive, if you like, engagement with the community and voluntary sector as in preparation for it. But it is a research-based report, so I think that's important to say. It's kind of an evidence-based kind of presentation. Now, what the research tried to do really was to put some kind of structured profiling on the sector as we come out of the pandemic. To kind of, because it hasn't really been done before. We know, it's well recognized that the voluntary and community sector is very active in the space and does lots of good work, but I don't think it's ever really been kind of fully appreciated by policy or indeed by the HSE. And that's not a negative thing, but just the whole shape of the sector and what it does and the volumes of activity and who it reaches. So we tried to come up with a kind of a mapping of the sector that we hope will be useful going forward in terms of informing some of the policy streams that I think are coming on stream this year. So it really is a historical, I think, and pivotal moment to be launching this report. It doesn't mean that the report is kind of rocket science or whatever, but we do think that the way it shapes the sector can be very useful in terms of informing the engagement. And at the end, I'll talk a bit about that. We think a co-produced exercise between policy, the HSE and the sector would be a very useful way to progress things with this kind of information as a way of kind of, if you like, informing the dialogue, but not fixed in stone as the only way to look at the sector. So the slides work now. So first of all, just to say a little bit, as Dominica said, I mean, the aim of this second report is kind of strategic. It's trying to take a kind of a whole systems view of the large numbers of organizations that operate in the voluntary and community mental health space. And also we've applied a kind of a policy, if you like, focus, not so much explicitly in terms of trying to map everything to the specific aspects of policy, but just it is useful just to flag it at the beginning that when you look at sharing division, for example, which is the mainstream, if you like, kind of mental health policy going forward, it has, when you start looking through it in the text, but also in the recommendations, it has a number of specific recommendations that are specifically about reinforcing and leveraging and funding and capacity building, et cetera, for the voluntary and community sector. So I think, we really have an opportunity and we need to make sure we don't miss it, in terms of really kind of informing the engagement. And I think there's lots more things you could add to this. These are the 4 recommendations that are actually in the implementation plan for sharing division at the moment. And just to mention also that we shouldn't forget about Sláintecare, because one of the things about the voluntary and community sector is that generally the services and supports it provides are either low or no cost, which I think is really fundamental, because this is this was, I mean, it's kind of we seem to lose sight of it sometimes in the narrative, but this was my idea of what the vision of Sláintecare was, that we'd have universal access to low or no cost services, healthcare and mental health care or whatever. So I think that there really is an opportunity to kind of to grasp that kind of original kind of idea of Sláintecare going forward, I think. So this piece of research, and I put up this slide, but was a bit hesitant to do it in a way. It's based on, most of the analysis is based on about 53 organizations from the sector. And you can see the ones, these are actually annexed in the report. But don't worry, if your name isn't on this, it doesn't mean anything at all. These are just the organizations that we could utilize for this particular lens we were applying to the analysis of the sector. And we do know that it's especially organizations who are kind of, if you like, engaging directly with people with mental health issues or mental health difficulties, or people who maybe are from vulnerable groups who have high prevalence of mental health issues or difficulties or whatever. But we do recognize that there are other kind of cross-cutting organizations that do different things, research and kind of more general sectoral advocacy and, stigma reduction, and all these things which are really, I think, relevant as well. But in the analysis anyway, there's 53 plus organizations covered in it. And I would say that they cover actually, because some of them are kind of national organizations with chapters in different counties or locations. There's probably about 120, I'd say, organizations represented in the data. You can see from the two little charts that I have there is that it just flags a few things. One is that the sector is very broad. You've got very large and very small organizations. And this is one of the strengths in a way, but also I think it's going to be one of the challenges for the policy implementation process to figure out a way to kind of equitably and effectively, if you like, leverage the capacity of all these organizations. And then just the other thing to say is, and it is relevant, I think, is that when you look at the profile of the organizations, you've got about half of them, or whatever it is, have specifically mental health as their core mission. And lots of the others have maybe, working with particular marginalized or vulnerable or other groups where mental health is one part of the activity that they do. So just to show maybe briefly, this is really kind of just to show that the sector really does, and you could profile it in different ways or whatever, that really does reach across a large number of groups. And I think maybe just two things to say about this. One is that quite a few of the organizations in the sector offer generic services. So there's for example, they don't target a specific group, but they offer, let's say, low or no cost, say, counseling or psychotherapy services in the community, for example. And then quite a few work with specific groups or whatever. So collectively, I think the reach of the sector and the kind of the groups that it covers is very, very broad and very useful. I think that this is important when you start thinking about how the policy kind of frameworks could be implemented. This kind of perspective is important, and this is not the only one that could be applied, but what we were trying to do was, by looking at the way the organizations describe their own kind of activities and missions, and also by doing a lot of research on available data in annual reports and impact reports or whatever it might be, to look at, what kind of mental health activities and supports are the organizations in the sector doing. And then later on, I'll tell you a bit about how much of them are they doing, so to speak. And we developed this framework on the left. It's basically a combination of kind of bottom up, looking at how the organizations describe themselves and their services on their websites. And then also with an eye to finding data, because we wanted to get numbers, if you like, the numbers of people reached through counseling or psychoeducation or whatever. And the chart on, moving on. Is the chair moving me on quickly, or is it just reading my mind? Okay, I'll move on to the next one. Okay, so having done that, what we tried to do, and this is, I say we should call it indicative, but it is fairly robust in terms of sizing, if you like, the sector. We tried to do some counting based on published data. Now, just to say that in the report, we don't report by individual organization. It's an aggregate sectoral report. I think that's important as well, because there are lots of subtleties and nuances in terms of, negotiating SLAs and all this kind of stuff and legacy funding. So we're not into the business of naming specific organizations. But when you pool together all the numbers, you can see that they're very substantial, certainly. And it doesn't mean because there's more numbers that it's more important. It's just these are the numbers you can get, for example. Not surprisingly, in a way, the helpline crisis services tend to have very high numbers of contacts per year, partly because it includes the very large players like suppose I could mention it because they're not actually counted specifically, but you've got Samaritans, you've got Pieta, you've got Childline, you've got who is it, Text 50808 plus. And as well as those kind of large scale national ones, you've got quite a few kind of, if you like, helpline services which are provided by the VCS, which are quite intensive because they one-to-one engagement or whatever. Then the second one I'll mention is, because I think it was mentioned by our chair, our overall MC for today, Jill, as well, counselling and psychotherapy is quite a big thing in the sector. And when you start counting up, if you like, the numbers of sessions provided by the VCS sector, these would be primarily no or low cost, or sometimes tiered cost, depending on the the income of the person or whatever. You get numbers like this now. I mean, you could parse this and you probably find more, in fact, if you start counting more organizations, but it's kind of the order of 220,000 plus. And just to put a bit of kind of scale on that, you could guess that, say, CIPSI, the Counselling and Primary Care Service, which is the one that's funded by the HSE at the moment at no cost for people on medical cards, it's probably, and I don't think the data is there at the moment, but 100,000 we could say per year or whatever, so this sector is providing kind of high volumes of this kind of thing. And I think the thing to say about it is that it's often not funded, because a lot of the provision in this space comes from organizations who don't get core funding from the HSE, for example. And so often it's reliant on fundraising, on kind of volunteers, and a whole range of other things or whatever. So this will be these kinds of themes are very relevant, I think, when the HSE and the policy frameworks for sharing divisions and indeed Sláintecare start, getting going. The chair can tell me when to shut up because I can talk forever, but I do think I have another minute or two, have I? Okay, so and then I'd just like to mention the last one. Oh, sorry, go back there for a second. It works for me. Yeah, just to mention the last one as well, and not in no particular order really, but that the number of 90,000 there for the other high volume activities might sound lower, but in fact, within that you've got things like recovery and social inclusion supports, where the extent of engagement is often very considerable. It could be anything from housing, finding housing, providing tenancy support, providing all the wraparound supports or whatever. So there's a huge amount of that kind of activity as well that all needs to be considered in working out the best way to properly integrate and support and fund, if you like, the sector to play its role in the system. And then I'm going to cut to the chase a bit, but I did want to say that, going back to what Dominica was saying at the beginning, one of the big changes in the sector, surprise, surprise, was the move to digital and online during the pandemic. And so one of the big themes I think that comes up from our survey and also from various webinars we had with organizations in the sector is, what to do after the pandemic. Like we kind of know that, digital can work now, and we've been working with it, and it has lots of advantages in terms of efficiencies and reach and whatever, and indeed, real innovation can be done as well. And there are some examples, I think, in the report of that. But, where are we going in the future? So most organizations, I think, want to keep some of the digital, but they're just, wondering, what kind of a balance between, face-to-face and online or whatever they'll do. And certainly I think the sector needs, and this is something that really does need to be flagged. I'm taking off my research hat, but the evidence does show it, on top of my advocacy hat. The sector really does need support with getting the technological infrastructures solidly in place, and also skills development, because not just in the voluntary community sector, but also in the public sector, there was a real needs must during the pandemic. So people were using all sorts of platforms that really wouldn't be fit for purpose for mental health purposes, so there's a need to kind of to recognize that, even if organizations during the pandemic managed to get their technological infrastructures, if you like, developed, they spent money on it. And I mean, we haven't done the research on the finances, but you can imagine that a lot of reserves and everything else was sunk into trying to get ready. So you're right. It doesn't bother me. I didn't want to put you on the spot either. So anyway, I'll move on quite quickly now because I'm actually nearly finished. That's somebody trying to move me on. I just wanted to get back. Oh yeah, I want to go back to that one. There's a gremlin in the system. Yeah, I just wanted to make the other point that, as well as this thing about the kind of the getting the blend between the digital and the face-to-face, I think that one of the biggest things really that needs to be kept center stage is that the reset of the system, you know, the public and the voluntary community sector system following the policy lines needs to keep face-to-face and physical location center stage. I mean, look at the excitement we all have today by getting together or whatever, but it really is really important because there is and this is just my kind of a general kind of feeling, when a new technology and innovation comes in, it has wonderful opportunities, but it also has a lot of efficiency things that you can jump to because you're tight with budget or whatever, you know. So the reset of the system really does need to, you know, to take this into account, that the sector, the mental health sector in general, needs to get back into doing what it used to do in terms of meeting people face to face and working with people individually, as well as using the, you know, the wonderful logistical benefits of the what do you call it, the digital. So I'm going to quickly move on now because the chair is going to, let's say, throw me out. So 2 recommendations, and they're evidence-based recommendations. I'm not sure whether I have my research hat or my advocacy hat on now, but one is to provide the funding and capacity building support required for the VCS reset. And then equally importantly, and the 2 are interlinked, to establish a policy-driven framework to build and sustain the sector going forward. And the 2 have to go together because one of the issues in this territory is that the way in which funding has been allocated, I'm not criticizing, it's just a fact that it's been quite ad hoc, I think, and also the way in which the sector has been leveraged, it's been quite ad hoc over the years with all sorts of historical factors involved in that or whatever, but it has led to kind of, if you like, you know, naturally kind of competition and jockeying for funding and all sorts of things, and not necessarily kind of even-handed, if you like, allocation of funding. So this is something to kind of to bear in mind, I think, so that it needs to be a policy-driven framework. So I'm going to move on to my last 2 slides because the chair is definitely going to throw me out. Sufficiently scaled funding is needed now for doing the 2 things I mentioned: the re-establishing traditional services, and, you know, really getting the kind of digital approach fit for purpose. And my last one, Murphy's Law. Yeah. Going back to the policy frameworks again, I think sharing the vision on Sláinte Care, and there are other ones we could mention as well, like Connecting for Life and Healthy Ireland. But these are the 2 kind of, I find are kind of the ones that keep me grounded in the sense of giving me a perspective, you know. And we certainly would encourage, and I think it's essential that there's a co-produced process as soon as possible, where the sector, in some manner, you know, through the collective bodies and the individual organisations, work with the HSE and the implementation processes from sharing the vision to make this happen. So apologies to the chair if I was a little late, but okay, thank you very much then.
No hard feelings. I forgot my hook at home. So